Hi friends, I'm Dr. Tejal Pandya, and I cure heartburn and antacid dependence. I'm able to do that because I'm a fellowship trained foregut surgeon. I'm specialized in doing the full range of testing, endoscopy, and treatment, including surgery, for people to make these problems go away. Yes, it is possible to make your heartburn totally go away. Now, I'm here making this video because I need to answer back to my friend Dr. Nabila Noor, who asked me what are the 5 most difficult words to pronounce in my specialty. So here we go. Number 1, I'm going to start off with the longest word, which is esophagogastroduodenoscopy, better known as EGD, even better known as upper GI endoscopy, and sometimes just called endoscopy. And what does it even mean? Is the procedure where we use a small, flexible camera that's barely about the size of my finger. It goes from the mouth and it allows us to examine with our eyes, with a video camera, all the way to the first part of the small intestine after the stomach. This gives me a chance to take pictures, take biopsies, examine the part which is going to be one of our next words where sometimes hernias form, and it gives me a very good idea of a lay of the land, making sure there's no precancer, making sure there's no ulcers, making sure about injuries and scars that are forming because of the reflux disease. Number 2, hiatal hernia. That's hiatal with a T. It's a little bit tricky, but that's why it's on my list. A hiatal hernia is the type of hernia that we tend to fix when people have reflux disease. Now, what happens is the chest and the abdomen are separated by a muscle you may have heard of called the diaphragm. Now, the diaphragm has some natural holes and spaces in it to allow organs like the esophagus to pass down through the chest and connect to the organs in the abdomen, in this case to the stomach. Now, the problem is when this natural hole gets too big and actually allows the stomach to crawl into the chest, taking up space in an area where it doesn't belong, and also kind of ruining and disorienting the normal anatomy and the normal relationship that we call the anti-reflux barrier to keep fluids and acid down where they belong. Number 3 on the list is manometry. Manometry is a procedure that we do in the office where we have a long, flexible, soft catheter that has sensors and electrodes on it. We pass it, yes, through the nose, into the stomach, and when I do it, I am there with you, coaching the entire time. This is a test that lets us understand swallowing coordination, muscle power and function in the esophagus. It lets us make sure that that heartburn is not actually some other kind of muscular disorder or neurologic disorder, and it allows us to get a perspective about what kind of treatment might be appropriate for you based on what your body is going to be able to tolerate. And that is manometry. Number 4 on the list is herniorrhaphy. Herniorrhaphy is a medical way of saying hernia repair. Now, in this case, as I was talking about hiatal hernia, the herniorrhaphy refers to a part of the surgical procedure where we are taking that hole, that opening, which is called the hiatus, back to its normal size, using sutures and sometimes using mesh. Finally, we're at number 5. Number 5, my word, is fundoplication. Fundoplication. Fundoplication means a folding or reshaping of the fundus. The fundus is a part of the stomach and it's quite stretchy and flexible. And we take advantage of this because when people are suffering from reflux disease, the part of the esophagus that naturally stays tight has usually been lost, and that is part of the problem that you're having. So we use the fundus to wrap around and recreate that strong closure within the esophagus in order to prevent the acid from coming back up again. So the fundoplication is a fundamental part of the anti-reflux procedure along with the herniorrhaphy or the hiatal hernia repair. And these are my 5 words. Number 1, esophagogastroduodenoscopy, also known as EGD or upper GI endoscopy. Number 2, hiatal hernia. Number 3, manometry. Number 4, herniorrhaphy. And number 5, fundoplication. If you want more details, follow along because you're in the right place. You can follow me here on Instagram, and you can also go and subscribe to my YouTube channel that's about to launch so that you don't miss any of the new information.